All right, so part 2, chapter 10, pharmacology. We finished up on slide 28. We're going to pick up on slide 29. So fiber. So there's two different categories of fiber. You have insoluble versus soluble. Another thing you're looking at is permeability and the beneficial metabolic effects from fiber. So fiber supplementation is recommended at 40 grams per day. And the typical U.S. consumption of most adults in the United States is only 15 to 20 grams per day. So that's why there's a lot of constipation issues. So bulk forming laxatives. These work because they remain in the GI tract, which allows it to draw in water and electrolytes into the GI system. This will trigger peristalsis and facilitate bowel movements. So its role in therapy is used in the prevention of constipation. And examples would be psyllium fiber, which would be like Metamucil or Fiberol. These are typically all of these, Citracel. These are going to all be found over the counter. Surfactant laxatives, they act as a detergent, which helps fatty and watery components of the intestinal contents to mix together, which will help make the stool soft and mushy, which helps an ease of getting the stool to move through the bowels and be able to be evacuated. Again, is used to prevent constipation. This oral liquid should be taken with 8 ounces of juice or milk to help mask the bad taste. Make sure to drink plenty of fluids to enhance the effects, and then to help offset some of the electrolyte imbalance that may result for excessive use of surfactant laxatives or long-term use. An example of this surfactant laxative would be docusate, which is Colase. Another term for this drug classification would be a stool softener. So they use that a lot to help soften up the stools. Osmotic laxatives, these would be things like lactulose or Miralax. These work by increasing the osmolarity of the bowel contents, which helps draw water in, which will help in facilitate a bowel movement. Saline laxatives would be things like magnesium hydroxide or milk of magnesia, something that we refer to as MOM, M-O-M. This causes retention of fluid within the bowel. It distends the colon and increases the peristaltic activity. Again, it's used as a laxative, but milk of magnesia is also used as an antacid, so it kind of has a dual role. It can be used as a laxative or an antacid. Because of the magnesium levels of this drug, it should be used in caution with patients with renal disorders. Stimulant laxatives. Now, the stimulant laxatives are the ones specifically that you're looking for patients that are on any type of long-term opiate use. These stimulate the parasympathetic neurons that control the bowel movements. Therefore, it enhances the peristalsis and GI motility. Again, is commonly used for opiate-induced constipation. There are some side effects. Because it is a stimulant, it can cause some mild abdominal pain. It can cause nausea and vomiting, and it can cause rectal burning. The stimulant laxatives must be taken with a full glass of water on an empty stomach. Miscellaneous constipation agents. So Amitsa activates chloride channels in the small intestine, which increases the intestinal fluid secretion. This has been approved for chronic idiopathic constipation. The main side effect is nausea. There is risk of shortness of breath or chest tightness, and then caution in any patients that have any type of liver dysfunction. Anti-flatulent agents or anti-gas agents. Simethicone is huge. You'll see it in different types. Gas-X, Gas-Aid, Mylicon drops. They even have Mylicon gas drops for infants, okay? It reduces the surface tension, which causes the gas bubbles to coalesce into a foam that can be eliminated by either belching or passing flatulence. Relieves flatulence, it helps with gastric bloating, and it's used a lot, especially for post-operative gas pain. So if a patient has had any type of laparoscopic surgery in the abdominal area, the way that they get their tools into the body is they have to bloat the abdomen out with gases. Now they try to suck as much of that out as they can after surgery, but a lot of it still remains, and that actually is one of the, in addition to the surgical pain, having those gas pains after that is something that the patients really complain about. So they're going to use an anti-flatulent agent to help break that up and get that gas moving and out of the body. Bowel evacuant. So things, these would be things that are, if you have not had a bowel movement in a week or longer, you would want kind of an immediate thing. So you're completely cleaning out the bowels. Another reason we would use this is for any type of testing. So if you're going in for colonoscopy or any type of test where they have to either do a scope through your mouth or a scope through the rectum to have everything cleared out. So one of the drugs that we use, the brand name is called Go Lightly. Sodium phosphate, magnesium citrate, you can actually purchase that over the counter. These work really well, too well in fact, where you want to stay close to the bathroom. So other GI diseases that can accompany constipation, so diverticular disease, which is an outpocketing from the bowel walls that will form and then become inflamed. A lot of times within those pocketing, food can get caught, so it can cause infections. Hiatal hernias. Hiatal hernia is a forcing of the esophageal junction upward into the esophageal hiatus. Irritable bowel syndrome, known as IBS, is the insufficient tone or spasticity of the GI tract to regulate bowel activity. Now, IBS patients can have chronic constipation, chronic diarrhea, or a combination of both. Hemorrhoids are an engorgement of the vascular cushions within the anal sphincter muscles. And a lot of people can get hemorrhoids from having constipation because the amount that they're pushing, trying to get the hard stools out. It can occur in childbirth. It can occur from excessive sitting. So there's a lot of different causes of hemorrhoids. We treat hemorrhoids with topical creams. So nitroglycerin is one of the top ones. This is actually prescription only. It helps to smooth the muscle relaxation. It will reduce the resting pressure on the hemorrhoids themselves, which will help with the healing. Now, hydrocortisone, known as Anusol AC, that is actually an over-the-counter item that can be purchased, and that is used to help decrease the inflammation of the hemorrhoids specifically. Nausea and vomiting. So there's actually what we call a chemoreceptor trigger zone, known as the CTZ. That is what triggers vomiting. Okay, so if anyone is similar to me, I hate vomiting, I hate getting sick to my stomach. I will literally have a conversation with myself in the bathroom of like, no, you're okay, you're not gonna throw up, keep it calm. Doesn't happen. Okay, I have no control over that because that is coming from the CTZ zone. It's already been put into motion. So vomiting or emesis, the effects of vomiting or emesis, which is continued vomiting, includes dehydration, electrolyte imbalance, and then the risk of aspiration pneumonia. Vertigo, the sensation of the room spinning when you get up or change positions. We treat that with anticholinergic agents. So if you have vertigo, that can make your stomach upset, okay? An antiemetic is a drug that works primarily in the vomiting center, the CTZ zone, to inhibit the impulses that travel from that CTZ zone to the stomach, which inhibits the vomiting. Again, we don't want to use any vomiting or antiemetic drugs that would prevent us from vomiting, especially for vomiting as a result of any type of bacteria or virus. That's our body's natural response to get rid of and expel the bacteria and the virus, so we don't want to inhibit that from happening. So antihistamines and anticholinergics, so they work together to block the histamine, which a lot of times is excess, which causes the nausea and vomiting, and then the acetylcholine, which is a neurotransmitter that is sent from the CTZ zone into the stomach. Serotonin receptors, so they block the 5-HT3 receptors in the brain and the GI tract, which stops the nausea signals from traveling from the brain to the stomach. Works really well. These would be the class of drugs that we actually use for patients that are on chemotherapy medications, so things like Zofran, which is ondansetron. These medications work really, really well to help patients who one of the main side effects of chemotherapy is the nausea and vomiting. Dopamine receptor antagonists, so we would have things like prochlorperazine, which is compazine, promethazine, which is Phenergan, and metoclopramide, which is Reglan. So they block the dopamine receptors in the CTZ zone, which stops the connection of these signals being sent from the CTZ zone into the stomach for vomiting. Hepatitis. So hepatitis is a liver disease that has several forms, which can actually damage liver cells, and cause the liver to become swollen and tender. So the three that we're going to look at in particular are A, B, and C. So hepatitis A is transmitted through blood or bodily tissues. It often produces epidemics due to feces to mouth transmission. So there was actually an hepatitis A outbreak here in southern Arizona, between here and Sierra Vista, in our homeless population. Supportive treatment is necessary, but hepatitis A can actually be prevented through vaccination. Hepatitis B is also transmitted through bodily fluids. It can also be transmitted through sexual contact and perinatally, which is from baby to mom. Chronic hepatitis B can be treated with antiviral medications, but more importantly can be prevented through vaccination. Hepatitis B vaccine is the universal requirement for any healthcare worker working in any hospital setting, including pharmacy technicians. You must have a hepatitis B vaccine or a declination if you're allergic to it or have some medical condition in which you cannot. Hepatitis C is transmitted through blood transfusions or illicit drug use, so people sharing needles when they're using illegal IV drugs. Treatment for type 1 is going to be outlined it says in the following tables. So after slide 44, we do now have a medication that's new, which would not be listed in this slide particularly, that we have that actually cures hepatitis C now. It's brand new, only been out for maybe a year now, and highly expensive. So the treatment and prevention. So we have what we call antiviral medications. So not only are these antiviral medications used for the treatment of hepatitis, but most of them are also used in the treatment of HIV as well. So complementary and alternative therapies to any type of GI disorders. Ginger. Ginger is used and has been used for centuries to help reduce nausea that is associated with surgeries, vertigo, and motion sickness. Some benefit in morning sickness, but there's not been enough rigorous testing to show that it's safe for mom and baby to take while mom is pregnant. It's thought to work by blocking the serotonin receptors, which is similar to the drugs like Zofran. Side effects include heartburn, gas, bloating, mouth and throat irritation, and then it is a natural supplement, so there are some drug interactions. It does interact with aspirin, warfarin, and any other anticoagulants, which are blood thinning medications. Probiotics. These contain live cultures of either yeast or bacteria, It is used for diarrhea, especially if you've been on antibiotics. They recommend you to take a probiotic to replenish the good bacteria that belongs there. It's beneficial for constipation, H. pylori infections. It helps to colonize the GI tract with beneficial organisms that are necessary for digestion and regular GI motility. They compete and replace or displace the harmful bacteria. Examples of probiotics, so lactobacilli, which is a gram-positive bacteria that is part of our normal GI flora. Saccharomyces boulardii is a yeast that actually lives within our intestinal tract or our GI tract. Florastor, excuse me, Florastor is an over-the-counter item that contains Saccharomyces boulardii, and they use that and recommend that specifically for antibiotic-associated diarrhea. Bifidobacteria may be effective for diarrhea associated with various causes. And so again, most of these have the side effects of gas and bloating, so that's something to be aware of if your patient or customers are taking any over-the-counter probiotics. Aloe. We know aloe works. Typically we hear aloe used for sunburns, right? Topically in those aloe vera preparations, but aloe vera actually works as a stimulant too. People can consume it in juice, capsules, powder. It does have side effects of diarrhea because it works very, very well. And then it should not be used by pregnant or breastfeeding women, particularly pregnant women, because if you are using a stimulant laxative while you are pregnant, it is inducing the contractions within the GI system to make a bowel movement, which can trigger contractions in the uterus and put the mom into preterm labor. And that completes chapter 10.